High blood pressure is a very common, very treatable condition that leads to a lot of death and loss of health in this country. And so if you look at the numbers, 1/3 of adults suffers from high blood pressure or hypertension. Of those 1/3, 1 out of 3 don't know that they have high blood pressure. And of the people who know they have high blood pressure, 1/3 of them just can't keep the blood pressure under control. They're not taking their medicines, or they're not getting their blood pressure under proper control. And so if you look, there's a lot of people walking around who have high blood pressure, and this high blood pressure leads to heart attacks and strokes that can be prevented. When we talk about this elevation in blood pressure, what we're talking about is the tubes, the muscular tubes that bring blood flow from the heart to the rest of the body. The muscles that line these tubes can be either relaxed when we have normal blood pressure, or they can be tight and tense. And when that occurs, then the space that the blood courses through is narrowed and the pressure is high. And that's what we're trying to avoid. When the pressure's high all the time, then the heart muscle gets thick. And if you look at this heart that's been working against high blood pressure, you can see how much thicker the muscle is, and the chamber, the space where the blood's pumped forward, is shrunk down. And so this heart can't pump blood very well, and it can go into failure. The other problem is that if there's a lot of pressure in the artery wall, then the normal cholesterol and fat that's in the bloodstream gets sort of jammed through cracks in the walls of the arteries, and these arteries have a tendency to clog. And when this happens, there's sort of a fat coating around the arteries, and this fat coating can reduce the blood flow, leading to heart attacks and leading to strokes, need for angioplasty and stents. And also, when the blood pressure's high, it can cause damage to the brain, leading to aneurysms and strokes, damage to the eyes, damage to the kidneys. And so it's very important for individuals to know what their blood pressure is. If you check your blood pressure at home, make sure you sit for about 15 minutes and relax before you check your blood pressure. If you check it right after you've been running around doing things, it's going to be artificially high. There's a lot of home blood pressure cuffs available. It's a good idea to keep your receipt if you buy one of these home blood pressure cuffs, so that you can compare the blood pressure with the cuff to the blood pressure that's done by someone at the fire station or at your doctor's office. So there's a real opportunity for us to find this 1/3 of adults who have high blood pressure and to get them on medications so that the high blood pressure doesn't cause lasting damage to their body. That's a Minute for Health.